Amid a surge in COVID-19 cases, Union Health Minister Mansukh Mandaviya held a key meeting with representatives from all the states today. Now, the meeting was conducted to assess the readiness of the hospitals and other COVID-related facilities, and the Union Minister also highlighted that there is no need to panic, but also it is very important to stay alert. He also suggested mock drill to be carried out in hospitals once every 3 months, and within the last 24 hours alone, the total COVID cases in India have gone up by 341, taking the overall tally of active cases in the country to 2,311. Alarmingly, COVID cases have doubled within the last 9 days, and 19 more JN1 cases have been detected in Goa and Maharashtra. Now, as the nation steps up vigil, Maharashtra has become the third state to advise a mask usage after Karnataka and Kerala. Meanwhile, Madhya Pradesh has also ramped up testing. Now, Telangana also is one of the states that is on alert, and there's also been one death in Karnataka due to COVID-19, but it's unclear if the person was infected with the JN1 variant. Delhi also, even as we speak right now, the national capital has so far 4 active cases after 3 new cases were detected in just the last 24 hours. Kerala, where the first case of the new JN1 variant was detected, now has a total of 2,041 active cases. Now, this means that Kerala alone right now has 90% of the total cases in the country, and 292 cases were reported in just the last 24 hours. Right, so we will be discussing this, we will be getting into the details, and we will also be talking about how this is going to affect the people across the country and all the measures that are being taken by the state governments across the nation. Joining me on the broadcast is my colleague Ila, who's joining us from the national capital. Shweta is joining us from Mumbai. Neha is joining us from Bengaluru, and also we've got a guest with us for this discussion, Dr. Manoj Kumar Goel, who is the pulmonology head at the Fortis Hospital, Gurgaon. Now, before I go to Dr. Goel, let me start with Ila. Ila, give us a sense of the meeting that had been called by the Union Health Minister. What were the details that were discussed, and what are the mandates that have been given to various states, because various health ministers from across the country had also come for the meeting?
Well, absolutely, Ashish. As the number of COVID cases are surging in the nations, the health ministry took an important review meet today where the union minister was present himself, and also the state health ministers were there virtually, and the health ministry said that there is no need to create panic, but at the same time they emphasis on surveillance as well as maintaining the COVID and also the tracking and as well as testing. They have assured that all the states government should work with union in this regards, and there should be no politics done as well. Now, Union Minister Mansook Mandaviya also said that there is no need to create panic among the people as the symptoms are mild, but at the same time there should be preparedness, and for that he also asked that every once in 3 months there should be mock drill in every hospitals across the nations, and also that the people should need to be taking precautions as well. Let me tell you that in Kerala and Karnataka, most of the cases are reported, followed by Mumbai. And talking about Delhi, there is 4 positive cases, 4 active cases in national capital Delhi as well. And in past 1 week, we have seen that the COVID cases have doubled. So it is very important for people as well to take precautions if they are above 60. But there is no mandate as such talking about in Delhi for a mask, and there is no new mandate on vaccine as well. And also health minister said that all the state make sure that all the positive samples should be sent to Insacog labs for genome sequencing, so that the new variant could be detected,
Right.
so that it could be clear what variant it is which is circulating in the nation right now. And as the JN.1 variant is circulating more in the nation, the emphasis was given by health ministry that should be no false circulation of information as well amongst the people, so that the panic shouldn't be there. Over to you, Ashish.
Right, Ila, appreciate you getting us those details there from the meeting that happened. Union Health Minister speaking to all the state health ministers, trying to come up with a strategy. I'll take that point across to Dr. Goel. First of all, Dr. Goel, appreciate you joining us for this discussion, a very important discussion this. Now, the message that is coming out from the Union Health Minister himself is the fact that there is no need to panic, but at the end of the day, it is very important to stay alert. Now, there's a lot of information spreading on social media about this new variant JN1. It is very easy for people to get distressed given the sort of information that spreads, and most of it is alarmist in nature. Give us a sense of what this new JN1 variant is, what are the repercussions, and also how different is it from the already existing variants? Is it any different, and what's the efficacy of the vaccines that are already there?
So JN1 variant is actually a descendant of the Omicron variant. And you know, the Omicron is highly transmissible, but was of very low virulence. So it infected people at large, but did not cause any serious infection. So similarly, it is basically a descendant from Omicron variant, and we got a lot of experience of Omicron variant that it was not very virulent, did not cause any havoc like the Delta 2 wave did. So, you know, the specific feature of this virus is that it can have, you know, it can escape the immunity acquired from the previous infection and from the previous vaccine. And secondly, it has, certain mutation in spike protein, additional mutation in spike protein, so that it can bind better with the ACE2 inhibitors. And therefore, you know, it is highly transmissible. So even if the patient has acquired immunity against COVID infection in the past, it can still transmit fast. It can infect people more. But given the nature of the virus, as it has descended from a very mild or less virulent strain, that is Omicron, it's likely to cause very less serious kind of infection or mild infection, where the people would present with mild symptom only and not a serious infection like, serious pneumonia or, causing various complications. So that is not likely to happen. But still, it's early, and we have to see how it behaves and how it mutates in future. The problem is that the virus load increases. If there is more virus in the circulation, then sometime it can mutate because it's multiplying fast. So once a virus multiplies fast, it can mutate. And if it mutates and develops into such certain, virulent strain, then it could be a problem. Therefore, we must try and stop its, transmission. That is the key at this point of time.
Right. Right, Dr. Goel. So the message that you are coming out with is that the transmission of the JN1 variant has to be stopped, and there is no need to panic at this point in time. Pretty similar to what the Union Health Minister is also saying. I'll take that point across to Neha, who's joining us from Bengaluru. Neha, Karnataka right next to Kerala, which is of course having 90%, nearly 90% of the total COVID-19 cases right now, active cases are in the state of Kerala. Karnataka, of course, borders it. What are the precautions being taken by the Karnataka government? What are the safety measures in place? And also, how are the citizens right now reacting to this? Of course, because there's a new variant, and every time there's a new variant, there's a sense of panic that spreads across. So give us a sense of what the situation is like in Karnataka.
Well, Ashish, the first thing that the government has made very clear is that there is no need for people to panic. Having said that, it's also, of course, important to keep your guard up at all times. What the Karnataka government, of course, has decided after today's meeting is that testing is going to be ramped up to about 5,000, people per day. Apart from that, also masks were earlier made mandatory for people aged above 60 years. But it's not just that now. In fact, all health workers at all health centers who would, of course, be carrying out the testing as well would have to mandatorily wear masks. Now, also, the most important aspect, of course, remains the border surveillance, which has been a cause of concern even during the previous strains, wherein we saw that, a large number of people, from the neighboring state of Kerala as well, entering Karnataka and vice versa, going back, of course, then with the virus. So we're seeing that surveillance at the bordering, districts, whether it's been Chamarajnagar or Kodagu for that matter, checkposts have been set up. Thermal screening is currently underway, of all of those people, of course, who are commuting between both the states through the borders. And that apart, of course, largely the important thing over here, of course, that the government is stressing on is for us to be responsible citizens, for us to remember that even as Christmas and New Year are right around the corner, and there is, of course, going to be multiple mass gatherings, that people, should, of course, be a little bit more vigilant. Any symptoms that they have of any of the previous strains of COVID is something that should not be ignored, and people, of course, have been recommended to get tested only in such case that these symptoms are, prolonging for a couple of days.
Right, Neha, appreciate you joining us on the broadcast. So all the measures that you listed that are being taken by the Karnataka government to ensure that people are safe and of course there is no spread, like Mr. Dr. Goel was also saying. Dr. Goel, now this was Neha, my colleague from Bengaluru, was getting us information about what the state government is doing, while we will focus on what the governments have to do, and there are guidelines in place. The Union Health Minister also spoke about it in the meeting. Do give us an understanding of what people right now, like a lot of viewers are watching us right now, what can viewers do right now to ensure that there is no spread as of such among their own communities, and also what are the safety precautions that can be taken to ensure that they stay safe from this new variant, which of course is creating a sense of panic right now?
First of all, there is no need of panic because the Omicron was with us and it caused very mild illness, so there is no need to panic. But yes, we have to be careful. That is very important, and especially the vulnerable group. So the people who are aged more than 60 years, those who have got a heart disease, underlying respiratory disease before, cardiac disorders, diabetics, they must take extra precautions and they must avoid visiting the crowded places. They must wear masks and they must strictly follow the COVID protocols, that is hand hygiene, cough hygiene. But otherwise, for normal people, the life must go on and there is nothing to panic. They must keep washing their hands. And if somebody develops few like symptoms like fever, body ache, headache, cough, then he can isolate himself in at home. And if the symptoms are persisting or finds that the things are becoming worse and fever is becoming high grade, then he should get himself tested for COVID infection. Because at this point of time, the influenza epidemic is also going on. So there could be a lot of confusion whether it is influenza or COVID, and the people may just may just get influenza infection and may just start getting panicky, thinking that is a COVID infection. So it's very important that we should not spread panic amongst the masses. But yes, one has to be careful, as I said.
Right, Dr. Goel, hold on to that point as I take the discussion forward to my colleague Shweta, who's joining us from Mumbai. Now, Maharashtra has become the latest state to enforce, masks are brought in, of course, in Maharashtra as well. Shweta, give us a sense of the situation in Maharashtra right now, the number of cases that are in, and also what are the steps that are being taken by the Maharashtra government to ensure that there is no further spread of COVID-19 in the state.
Well, absolutely, Ashish. First of all, one must understand that there's no significant surge as far as COVID cases are confirmed. But definitely, yes, there has been a gradual spike which is being witnessed. And for this very purpose, what the Maharashtra government has done is that they have issued the advisory to bring up the mask again and to follow the COVID appropriate behavior. These are the major highlights one can understand what the State Health Department has come up with. Apart from this, what we also understand is that from their own end, the Health Department is ramping up the testings of RT-PCR. Apart from this, to contain the virus is also one of the great cause of worry for them, as we understand that the new Omicron subvariant JN1 is something that is bringing a cause to people around. And as far as Maharashtra is concerned, now remember, when it comes to the state, the advisory is issued to make use of masks, especially to older citizens, the senior citizens. Apart from them, the pregnant women are suggested to make use of masks, and particularly when it comes to the public gatherings, they should ensure the COVID appropriate behavior has to be followed. Ashish, if we just go through the trend, this suggests that in past 24 hours, there have been 8 cases of COVID, which has been reported from Mumbai. And apart from this, if we just see the total tally of Maharashtra state, that is to up to 24 new COVID cases in the state. But here, as I have mentioned again, there has been nothing sudden spike in COVID cases. Just a little thing, Ashish, with this, to conclude, there has been a case from Thane, from Kalwa Hospital, a suspect that is already being treated at Kalwa Hospital of subvariant of Omicron JN1, but this has again not been confirmed by the health official sources of the Maharashtra state. But yes, what we understand is that there is a slight cause of worry, but nothing has to be panicked as of now. Ashish.
Right, Shweta, appreciate you joining us on the broadcast. Also, Neha and Ila, appreciate you joining us from national capital and also from Bengaluru, getting us all those details from on the ground about what the governments are doing, about what the situation is like on the ground as well. Let me take this point across to Dr. Goel, who continues to stay on the broadcast with us. Dr. Goel, now this is of course a season wherein there will be a lot of cases of influenza as well, and it is very easy for people to confuse between influenza, seasonal flu and also COVID-19. So is there any way a person can understand if this is if the symptoms that they are facing are just limited to influenza or seasonal flu, or if there's a possibility of it being COVID-19?
See, the symptoms and the manifestation of both influenza and COVID are the same. There is no difference. Both will present with fever, cough, body ache, sometimes loose motion, headache. So symptoms would be the same. But yes, if more and more people are getting infected in the family, means the COVID virus is much more infectious as compared to influenza virus. Then, and especially somebody in the family is elderly and who is vulnerable, like I told you, having diabetes, cardiac diseases, or any underlying respiratory diseases, then these people should get themselves tested. Otherwise, routine testing is not required. So if the fever has been persisting, say more than 2 to 3 days, has got a high-grade fever, or somebody is feeling breathing difficulty, incessant cough, or oxygen saturation seem to be falling, everybody has got a pulse oximeter at home, say it's coming down below 95%, then he should get himself tested for COVID infection, that is the JN1. And if positive, then yes, they must report to the authorities and appropriate actions can be taken.
All right, Dr. Goel, appreciate you joining us on the broadcast. We've, of course, been discussing about COVID-19, the new variant JN1, the efficacy of the vaccines against JN1, and also the steps that the governments need to take and also the people need to take to ensure that there is no further spread of COVID-19. Really appreciate you joining us on the broadcast with all those details there. In fact, we've also been getting all the reactions from on the ground from the ministers across various states. Let's listen into all that.
Basically, they have asked us to continue our preparation, keep vigil, increase our testing, and ensure that all oxygen and beds and ventilators and all that is all in place. And any major outbreak, the government should be prepared to handle it. But they are saying this variant has been the JN.1 variant has been around for almost a few months now across the world, and there's no need to panic. It's a subvariant of the Omicron. So just keep testing more. Karnataka is now the highest in India in number of tests in the last 24 hours. So we have a target of increasing it to 5,000 by Saturday.
जो सिचुएशन मान लीजिए 1.5 महीना पहले थे उसके मुकाबले में बढ़ोतरी हुई है, पॉजिटिविटी भी कई जगह पे बढ़ी है। ओवरऑल जो डिजीज हम देख रहे हैं वो माइल्ड है, खांसी जुकाम है, माइल्ड फीवर है और सीरियस डिजीज नहीं है। लगभग 90-92% लोग अपने ही घरों में हैं और जो टोटल 16 डेथ हुई हैं पिछले 2 हफ्तों में, एक दिन में नहीं 2 हफ्तों में, और वो उन्हीं में हुई हैं जिनमें कि सीरियस कोमॉर्बिडिटीज हैं। उसके साथ चलते ही जैसे फ्लू में भी, साधारण फ्लू में भी बढ़ जाता है सब कुछ, विंटर के महीने हैं, ओल्ड एज के लिए मुश्किल है, वही स्वरूप हम इसका देख रहे हैं। इन शॉर्ट जो डिजीज सामने है वो माइल्ड है।
Now, 90% of the COVID-19 active cases in India are from Kerala, and of course, this has caused a lot of concern in Karnataka as well. In fact, earlier my colleague Neha got us this report from Bengaluru. Take a look.
As there are talks of COVID cases coming back to India, is there a need for you to panic? Should you be worried? Well, the Union Health Government says not, but having said that, there is a need to be vigilant and alert. There was a meeting that was held today with all of the state health ministers, and in light of cases being reported, especially in Kerala, the state of Karnataka too has now in fact been put on an alert mode here. While there's no panic that's been created, the government has said that the state should be alert and measures should be taken. Now, the Karnataka government, in fact, has mandated the wearing of masks for 60+ people across the state, especially in crowded areas.